And welcome to the program. Thank you for joining us on At Issue. I'm H. Wayne Wilson. In 1965, approximately 50% of men were smokers in the United States of America. Approximately a third of women were smokers. In 2003, those percentages had dwindled to 23% of men and 19% of women. So it's not too surprising that the state of Illinois recently passed and is now in force a law banning smoking in most locations, what we call public locations in the state of Illinois. You'll be surprised at how comprehensive the list is. And to discuss that, I have invited Kathy Drea to be with us. Kathy is the Director of Public Policy for the Greater Chicago and Illinois chapter of the American Lung Association. Thank you for being here.
Thank you, H.
Don Welch is here. Don is Vice President ×2. He's Vice President of Hotel Père Marquette, which many of you will recognize him as representing the hotel, but also Vice President of the Peoria Area Hospitality Association. Thank you for being here.
Thank you.
And joining us from Pekin Hospital is Ann Dierker. Ann is the Vice President of Human Resources for Pekin Hospital. Thank you.
Nice to be here. Thank you.
Let's first start with Kathy, if you could give us a little bit of background on when this all got started in the legislature and when it went into effect, et cetera.
Okay, well, first of all, in 1989, the Illinois legislature passed the Illinois Clean Indoor Air Act. That particular law required, or it prevented local municipalities from regulating smoking in public places. For 16 years, we tried to reverse that preemption that was in that law. And in 2005, we were finally successful with that. And we started passing local smoke-free laws. We passed 46 local smoke-free laws in Illinois in 1 year, covered more than half of the population of Illinois. It was the most local smoke-free laws ever passed in one state in 1 year. And we felt after that 1 year, we were ready to push for a statewide law. Starting January 1st, 2008, Illinois went smoke-free, and we are the 22nd state to be 100% smoke-free.
And when you say we in your statement, you're referring to the American Lung Association.
Yes, we worked with many other groups. We worked with the American Cancer Society, the American Heart Association, every physicians group, many local health departments, the state health department. It was a very, very large coalition.
Let's take a look at a list of some of the areas that are affected by the Smoke-Free Act of Illinois that went into effect on January 1st. If you could tell us, this is a representative list, by the way.
The Smoke-Free Illinois Act affects all indoor public places and indoor workplaces, and that would include all public buildings, all schools, retail stores, all restaurants, all bars, all gaming facilities, all auditoriums, bowling alleys, private clubs, healthcare facilities. 75% of all hotel rooms must be smoke-free, and any government vehicles also must be smoke-free.
So we see the location bar, and immediately we know that there's some bar owners who have a problem. Bar owners are members of the Peoria Area Hospitality Association. What have you heard from them?
Well, I've heard concern from the bar owners that this will negatively impact their business. As Kathy has pointed out in our earlier conversation, that may or may not in the long run be the case, but at this point I think it's really too early to tell, only having been 7 or 8 days into the new year.
Let's look specifically at Hotel Père Marquette.
Mm-hmm.
You've had a week to kind of gather your thoughts on how this is working. Have you had any problems?
We really haven't. We've had no complaints. We've had no violators. We have a situation where our restaurant is open air right next to the bar, and I think this will actually positively impact us in the restaurant because you won't have the secondhand smoke filtering from the bar into the restaurant.
How have you gone about informing your employees about the act, and also about informing them that maybe they can help you enforce the act?
Well, we've communicated with our employees that obviously the new law went into effect January 1st, that they can no longer smoke on the premises, that the patrons are no longer allowed to smoke on the premises, and that they should handle it in the same way as if they had anyone else violating a law. Deal with the issue, look at the better good of all of the patrons and all of the guests, and make sure that we provide the best customer service.
And the law requires that you be at least 15 feet away from an entrance to a facility?
An entrance, exit, window that opens, or ventilation intake.
Let's turn to someone who has had some experience in regard to this. It was last July that several area hospitals, including Pekin Hospital, went smoke-free. What was your rule?
Our policy, and we had the advantage that similar to this new law, we all went together. So our hospital and several of the other area hospitals all chose to make the change at the same time. Our policy is that it's campus-wide. So rather than just the 15 feet, our facilities all said the full campus, so that is inclusive of parking areas, sidewalks within the premises. So it's a little bit broader definition.
From a practical point of view, what's that mean when an employee pulls in?
Well, the expectation is when they arrive on our campus that they stop smoking.
They're in their car.
We said and we clearly articulated that smoking in your car was prohibited. Now, there probably are some people who are finishing their cigarette while they're getting out of their car, but we tried to put some parameters around it.
Don talked about he hasn't had too much of a problem right now. He's only a week into it at the Hotel Pere Marquette. What kind of problems did you face when you first went into this? And you've had 6 months now.
Correct.
What have you had issues with employees or with clients, patients?
We've had a few. I would not say that we're 100% compliant, but what we did is we had a longer lead time so we could create the expectation. With our staff, we made it perfectly clear that these were the policies, we expected compliance. We probably have a few people who, especially on those off shifts, who may bend the rule a little, but we have counseled some employees, we have disciplined some people if they have continued. With the public, it's a little bit harder to do. As Don said earlier, we've tried to take a customer service approach, make sure that they're educated on what our expectations and our policy is, and encourage them that they need to leave the premises if they choose to smoke.
You said you've disciplined a few. What is the disciplinary action?
We have a progressive disciplinary process. So the first time they get the verbal counseling on it, but if they continue, then it will be a written warning and documented in their record. I'm only aware of one person that they've had to do that with, and that was after a couple of conversations.
In terms of the statewide ban, what is the enforcement procedure at this point in time?
Well, right now, all violations are reported to the Illinois Department of Public Health. They have a toll-free number and a website where you can report a violation. They then distribute those complaints to the local health departments. The local health departments then have some leeway with what their options are. But the recommendations are that the first complaint they get for a business is that they send them an informative educational type letter explaining the new law. If they get another complaint on that same business, then they would send them a second letter, which is more of a warning type letter. And then if they get a third complaint, then they would actually send someone out, and they would probably go with an actual law enforcement, member of law enforcement to issue a ticket. They don't have to do that. For instance, if a bar owner goes on TV and says, we are not enforcing the smoking ban, they don't have to go through that 1, 2, 3 kind of progressive enforcement. They can go right in and do a compliance check first. So there is a lot of leeway in the enforcement.
There are fines associated with the different levels?
There are. For a business, it's $250 for the first offense, or I should say not less than $250, not less than $500 for a second offense, and not less than $2,500 for a third offense.
And for the individual who is the offender?
Not less than $100 and not less than $250 for a second offense.
Don, does that concern you as a business owner if you get a client of the hotel who comes in, maybe he or she is staying in a smoking room, but comes into a common area and starts puffing away, and you are liable as well as he or she?
Well, again, I think the way that we would deal with it is in the best interest of all of the patrons, all of the guests. If we have an offender, maybe treat it no differently than if we have had someone that's maybe had a little bit too much to drink. Try to talk with them, try to encourage them to follow the law. If they refuse, we would actually make a report to the state of this individual, and deal with it in a manner that would try to create as little controversy, as little confrontation as possible, but yet encourage the individual to comply with the law.
And a facility such as the Hotel Pere Marquette that takes that action, if there was a complaint over that incident, their actions may mitigate the fine?
Right. They protect themselves.
Do we know whether or not going smoke-free can lower the smoking rate of the residents of Illinois?
We have seen in other states that have been smoke-free for a number of years decrease in both the adult and the youth prevalence rates.
Is that based on a smoking ban, or is that in conjunction with higher taxes? Because I know Illinois is considering higher taxes on cigarettes as well.
Right. Some of the states it could be a combination. California is a good example. They went smoke-free in all restaurants in 1994. Then they came back and passed a smoke-free law in all bars in 1998. And they have seen a decrease in both youth and adult smoking prevalence rates. And their cigarette tax in California is actually lower than our cigarette taxes here. But they also have had some other kinds of youth prevention programs that are much stronger than what we've had here. So it's kind of hard to pull out one of those programs and say that this is why they have a lower smoke-free or lower smoking prevalence rate.
Don, have you had occasion to talk to any bar owners who have beer gardens or are anticipating building beer gardens? And if so, what are their concerns? Because as Kathy mentioned earlier, there's that 15-foot rule from any entrance or exit. Well, many beer gardens that I know are immediately adjacent to the bar.
Actually, I've had no discussions with anyone that's planning to build outdoor beer gardens because of this, or have plans to do so. I just haven't had those conversations.
Are there any that have expressed concerns over current beer gardens that because they're too close?
Not to me.
Okay. But that does apply, doesn't it?
It does apply. We have had many questions. This summer we had lots of different architects calling our office wanting to know, how to build these new beer gardens and things. And basically, if it is 15 feet from the door and it does not meet the definition of an enclosed place that's in the Smoke-Free Illinois Act, then they should be able to smoke there.
Because you're campus-wide, you don't face the 15-foot rule. Is that true for the other hospitals that went smoke-free last July?
Yes, pretty much all of the hospitals defined that as campus, not just building. So it was, the full perimeter of their properties.
You have referred to enclosed buildings. Is there a definition for enclosed building, or is that up to JCAR?
No, there is a definition in the Act. I would have to read it to you. It's very definitely written in legalese. It's not something I have memorized.
Okay. All right. So but with regard to beer gardens, there's some beer gardens that are fairly enclosed, and I suppose that might enter into the discussion.
They would have to look at the
I
definition.
mentioned JCAR. They just recently looked, because the rules aren't specific yet, are they?
Not exactly specific. There are some technicalities. There's a couple of different universities who have research facilities where they actually look at how smoking affects a person's body. They look at brain waves and things like that, and they are seeking an exemption from the Smoke-Free Illinois Act, and that's one of the things that JCAR was looking at.
Have you had anybody come to the Hospitality Association and say, gee whiz, are we exempt, or can we seek exemption? Has that come up at all?
It has not.
Probably because the law is so specific.
It is very specific, but we've heard, in fact, in my hometown, which is South Central Illinois, we had a private club who had actually already started their fundraising. They had heard that they could purchase a smoking license and that it cost $8,000. And all of that, of course, was not true. And we've heard lots of different things like that. Maybe hopeful, I don't know. But
Private clubs?
No, they have to be smoke-free.
Even if you pay membership to go in?
Right.
So this is comprehensive.
Mm-hmm. When we wrote the law, we tried to be as fair to everyone as possible.
You mentioned earlier, Don, and I want to go back to this issue about you look at all of your customers
Mhm.
Do you anticipate this being good overall?
I do. As far as the hotel business is concerned and our restaurant business, I think that it'll be positive overall. Because again, the open air atmosphere between the restaurant and the Rendezvous Bar, that also being the entrance to the hotel, it was offensive to some people to come by and smell that secondhand smoke. So I think it'll be positive overall.
I know it's only been a week, and obviously just after a holiday. Have you had any measurements so far as to?
No, it's too early to tell.
Too early?
Too early to tell.
Might it be different? Have any bars called you and said, gee whiz, business is down? Or?
I have talked to a couple of bar owners that have indicated that their business has been down so far this year, and again, it's only been a week. So, you know, we're all hopeful that that'll be a short-term situation, and that people will come back, as Kathy's indicated has happened in other areas.
Springfield, smoke-free for some time now, bars included.
Right, private clubs also.
What was their experience in terms of income?
The Illinois Department of Revenue, their reports after the first 2 quarters after Springfield went smoke-free, and they separated out eating establishments and drinking establishments, and both saw an increase in business. Bars saw a slight decrease in the amount of increase that they had compared to previous months, but they did still see an increase in business. And then in the second quarter after the law passed, they actually saw a huge increase in business. And can I just add to that, that there have been economic
Absolutely.
studies done all over the United States and in other countries, and there has never been one that has shown a negative economic impact. Now, some of the tobacco industry studies that have been done do show a negative economic impact. They're based on feelings and estimates and things like that, whereas the studies that have been done by government agencies or universities and are based on sales tax receipts or other cold, hard data have all shown either no economic impact whatsoever or a positive economic impact.
At Pekin Hospital, you have, as we mentioned, 6 months of track record, but you really don't have a customer base like Don would be talking about, where he's attracting restaurant, bar, and hotel clients. But still, you must have gotten some feedback from people who come into the hospital. What has that been?
It's generally been positive, mostly because they appreciate a smoke-free environment. And again, our buildings were smoke-free previously, but now you can walk into the entrance, where before you may have to go through the smokers who were clustered outside. So by moving that further away from the entrances, you know, it's created a smoke-free full environment. We do know that we have, especially family members of patients who are in, where if it's a stressful time, are still smoking, and we've tried to, again, take a service perspective and just encourage them that they would need to leave the campus to do that.
Is there encouragement from the hospital administration to quit smoking? Because as I read it, you've got an 8-hour stretch. If you're a smoker, you're going to go 8 hours without smoking a cigarette.
Right. We started, and again, we had lead time, but we, like the other hospitals who participated in that earlier date, all have incentive programs, so we will reimburse employees when they complete a smoke cessation program. And we also have an incentive that if they stay smoke-free for 6 months, they'll receive a cash reward. And the other hospitals and AMT have done the same, really to take a proactive approach, so not just the punitive, but to really encourage people for their own health to take the steps if they are a smoker and have not been able to quit, that this is the time.
The hotel's a little different environment than a healthcare facility, but are you encouraging employees to quit
Absolutely.
smoking?
Communicating with the employees that programs are available, both through the state and locally, to assist with becoming smoke-free.
Is this going to be beneficial to whether it be hospital or hotel or bar? I mean, in terms of insurance rates, in terms of health insurance?
Well, we would certainly hope so, that we would see that the cost of health care would decline as people quit smoking, more people quit smoking, and there'd be fewer problems as a result of smokers. I would certainly hope to see that the health insurance premiums would come down.
Well, I think
Any
the other
experience?
thing that's happening is there is a trend from insurance companies to differentiate premiums. So because there's a clear correlation with increased costs from smoking, many employers are now looking to say, do we do differential pricing on what employees pay as part of that premium if they are a smoker? And there is a trend, a lot of, I don't know so much this year, but in the next year or two, you'll see more companies and more insurance companies taking that stance, that if you choose to be a smoker, then there is a penalty associated with it, not just with the sales tax, but in your health care cost.
The other thing that you see is fewer employee absentee problems. And for instance, in a bar, you would have less cleaning costs when you go smoke-free.
The states that are adjacent, immediately adjacent to Illinois, are any of them smoke-free?
No, they are not. Wisconsin is very, very close. Iowa, they have a law like we did in Illinois that prohibits local municipalities from passing smoke-free laws, and we're working very hard in Iowa right now to reverse that. So you really have to have those local smoke-free laws first before you go to a statewide law. Indiana is very close. No activity really in Missouri or Kentucky.
So,
I need to correct that. There are several local smoke-free laws in both Missouri and Kentucky.
but not on a statewide basis?
But there's nothing really moving on a statewide basis.
So if I'm a casino owner, bar owner, restaurant owner, right on the Mississippi River, for instance, I've got competition immediately across the river.
You do. You have to always remember, though, that 80% of our population does not smoke, and it could be that people will be crossing the river to come to your place because it is smoke-free.
Okay, so far we've talked about where we can't smoke. Where can we smoke?
You can still smoke in your private residence, in your private vehicle. You can smoke in retail tobacco shops, and there's a very tight definition on those retail tobacco shops. You can smoke in some nursing home rooms, and you can smoke in some hotel rooms. Up to 25% of hotel sleeping rooms can still allow smoking, but that depends on the policy of the hotel.
And the hotel policy at the Hotel Marquette is?
We have 2 floors that are still smoking floors. 1 floor of regular guest rooms and 1 floor of what are typically used as hospitality suites. And those currently are still smoking guest rooms.
And you'll keep them that way for the foreseeable future?
For the foreseeable future.
There is an individual here in Peoria who has received a lot of television time. He owns a hookah bar, and I think there's a stipulation as to what a retail tobacco establishment is. Right. 80% of your sales has to be tobacco or something like that.
Yes.
So a hookah bar, you can go in and smoke?
As long as he does not have any kind of a food license or liquor license and meets that 80%, 80% of his sales have to be tobacco or tobacco related.
And a hookah bar, for those that aren't quite clear, it's I think that's where you smoke tobacco through water.
Right.
Okay. So, how many complaints have we had so far in the state of Illinois? I know it's a 1 week here, but
we heard late last week that they'd had about 50 complaints, which is very low for a state our size. We felt like that was very successful.
And the enforcement level at that point, has anyone gone out and done any enforcement, or is that?
I'm sure that some of the local health departments have. We have not been a part of any of that. We will be doing some kind of compliance checks in the near future. We've also done some air quality tests, and it's interesting to compare the air quality before the law and after the law. Does
Springfield or anybody done air quality checks?
Oh yes, we've done extensive air quality checks in Springfield. Mm-hmm.
And obviously the air quality is better.
Oh my goodness, yes, huge difference.
Is that a technical, oh my goodness better? Is that technical?
Yes, that's very technical.
Okay, and on that high note, we'll thank my 3 panelists for being here for a discussion. I'd like to say thank you to Kathy Drea of the American Lung Association, Don Welch of the Hotel Marquette and the Peoria Area Hospitality Association, and to Ann Dierker of Pekin Hospital. Thank you all for being here on At Issue, and we'll maybe invite you back for a short update on how things went after we've had some track record time.
Great.
Next week, please join us on At Issue as we don't often invite sports figures onto At Issue, but next week we are going to be talking to some sports figures, but not really about their athletic accomplishments, more about how the soccer team at Bradley University came together after a tragedy. We'll be back next week with that discussion here on At Issue. Thanks for joining us.